Hello everyone, welcome to my channel. Let's talk about cancer. This is Thyroid Cancer Awareness Month and let's talk about thyroid cancer. So thyroid cancer is a diagnosis which is made by a patient who comes to us with a swelling in the lower part of the neck for which they are worried. Most often this is not cancer. Most of the swellings that occur in the thyroid are because they are filled with water called as a colloid goiter, or because they have low iodine and the whole thyroid gets swollen up because it needs iodine to function normally. So most often it is nothing to worry about and it is not a cancer. In a small percentage, in about 5 to 10% of the patients, it is thyroid cancer. And if they are younger than 50, and unless it is anaplastic variety, most of them do exceedingly well. So it is not a cancer that you need to worry about. So what is it that you have to look out for? If there is a swelling in the lower part of the neck, if there is something somebody notices, they see a swelling when you swallow or when you drink water, that is something you need to get it checked up. If you have difficulty in swallowing, change in voice, difficulty in speaking, you need to get it checked. So how do we go about diagnosing thyroid cancer? When you meet your doctor, an oncologist like me, then we will ask for an ultrasound. The ultrasound will be able to make out exactly what type of nodule it is, whether it is something to worry about or it is something very benign. If it is benign, most often some medications may be enough. Whereas if it is looking suspicious, then your radiologist only, while doing an ultrasound, will put a needle and take some cells for testing. And with the combination of the ultrasound and the needle test, we will be able to diagnose this thyroid cancer. If it is thyroid cancer, the first line of treatment usually would be a surgery to remove the entire thyroid gland. And if the report of that is favorable, that might be the end of your treatment. If it says that the cancer is there and it is slightly bigger, then we may need to give some treatment after this called as radioiodine therapy. This is not radiotherapy, this is not chemotherapy. You need not worry about the side effects, about the skin becoming dark or skin peeling or having hair loss, having acidity. None of these side effects occur in this treatment. This is a simple form of treatment in which they give you a half a glass of a juice, which after drinking they take a scan to see what is there, and with the same amount of juice they are able to finish your treatment completely. It's a painless treatment, easy, simple, without any side effects, and at the end of it your chances of cures are very high, upwards of 97 to 98%. So let's not be scared about thyroid cancer and let's face it. Let's go meet the oncologist and let's take the treatment. Good day.